Great. So now we have Vincent Schell, the co-founder of SpineDAO.
Un, deux, un, deux. Hey, GM Dubai, GM DeSci, I love you. First of all, I want to thank Molecule and all the bio team. You guys are totally incredible. I mean, you don't measure what you are doing. For me, it's like the duty of our generation is just revolutionize science. And in the context of SpineDAO, it's revolutionize spine health. So I'm Vincent Schell, I'm a spine surgeon. So I put screws in your back. Who in the audience experienced backache, back pain? Once lifetime? Maybe, yeah, maybe all of you. Who had surgery? One, maybe two. Okay, this is my typical office hour. So I see 100 patients per week and in my office and for back problem, and I operate on maybe 6 to 8. So 90% of the people that are coming in my office are not appropriate surgical candidates. And that's just a huge burden. So it's the gray button. Wow. Black screen. Perfect. And it's a burden for the patient because the patient is waiting for like 3 to 4 months to see me. And when he sees me, I'm like, I don't have the solution. It's not putting screws, rods, or cage that would solve your problem. It's a burden for me because I need to see 100 patients a week, and it's like 35 patients per day. So it's just a robotic rhetoric. How have you been? What painkiller you take, etc., etc. You need to leave a little space for the empathy for the patient. I'm doing this since like 10 years in private practice. It's just unsustainable for me, and it was part fueling the idea of SpineDAO, basically. It's also a burden for the payers, because basically in 90% of the case, the payers are paying for inappropriate care. That's huge, and you need to know that this is shared everywhere in the world. It's not a French paradox, it's not a French specificity. It's shared in China, in Japan, Saudi Arabia, in US also. It's even worse in the US. So if I put this button, it will go black again. Can someone help me? Like this? Wow. So imagine I have my 1 out of 10 patients that are surgical candidate. Yes! I can put him in the OR. I'm super happy. And what do I do? What is my strategy? You need to know that there is no consensus for a given patient. We have a WhatsApp group of 120 plus spine surgeon, orthopedic surgeon, and neurosurgeon. For a given case, you have a wide spectrum between the limited endoscopic decompression and the instrumented anterior, posterior lumbosacral reconstruction. So there is no consensus in our surgery, and it's a pity because basically we are doing an aggressive surgery with up to 50% complication rates and 30% revision rate at 2 years. So we need to build credibility and consensus. Also, I don't want to see well-being patients post-operatively in my office. Basically, I love to see well-being patients post-operatively in my office because in Périgueux, Dordogne, France, they bring black truffles and ducks and red wine. So I'm super happy, but basically they are taking a slot for a patient in need. So these 3 inefficiencies, we identify these, and it fuels our 3 research projects. So how does SpineDAO works? So basically, it's an AI agency with 2 arms. You have Lamina arms, that is the patient data system. So we already built a patient data set of 300K patients with 65K operative patient, 30K patient at 2 years follow-up. So we are fueling our predictive model from this existing data set, but we want to be prospective, and we want to also bring the blockchain in that system, because we are convinced that blockchain is the guardian of AI. Like, think about that. Blockchain is the guardian of AI. Like the data that we gather, for the moment, they are siloed, we know that. But we don't know exactly who is doing what on this data. The industry is doing some stuff on the data. We don't have feedback. Researchers are doing some stuff on the data. We don't know exactly what they are doing. But the blockchain technology allows transparency, immutability, and incentive. And that's why we want to use the blockchain for the use of our data. So what we want to do, we want to build predictive model, filter, a smart appointment system that can provide the 90%, that can treat the 90% burden, decide, a surgical strategy assistant, and also tracker the use of Internet of Things to monitor postoperative patients. And we also have another arm that is Sapiens, is the knowledge engineering. So we want to build the largest repository of spine science in open access, because DeSci, it's also publishing, and publishing in open access with incentive for researcher and also peer reviewer, because that's the main bottleneck of traditional science. Make no mistake, we don't want to fight traditional science. We don't want to destroy traditional science. Basically, our core team come from traditional science. And I will show you the core team after. But what we want to do, we want to use new technology to build a more balanced system. So going to filter, I will be super quick. So it's a smart appointment system that allows the patient, when he comes to the surgeon website and he wants to click to the appointment system, gather some data. So it is our first AI agent, a chatbot. And then you have a second AI agent, the predictive model, that is able to calculate the surgical candidacy in terms of probability. This one is surgical, this one is not surgical. And the third one is the smart appointment solution that takes the appointment, fills the surgeon agenda from the predictive model. This surgical patient, appointment in 5 days. This non-surgical patient, maybe we can put him in another practitioner, chiropractor, physiotherapist. Or if he wants to see the surgeon, it will be in 2 months. So this is our roadmap. Basically, we want Filter to be commercialized in Christmas 2025. This is our token distribution. And look, we have this 15% data sharing rewards, quite the similar that Idan showed us. And this is our circular economy model. So if we are able to build a smart appointment system, basically surgeon, insurance, and hospital would love to pay for that. And what we want to do is they will pay in fiat because they are crypto naive. What we want to do is we want to buy back in stablecoin, spine token, and IPT. So basically, it encompasses what has been said this morning. And last but not least, it's based on the human community. We truly believe that AI is a tool. It's just a tool that helps us to help patients. So it's patient, practitioner, and researcher all together. So we are in the middle of the auction, thanks to our incubator bio. And don't hesitate to come to see what's going on and maybe to put some Solana on it. Thank you so much.